Thank you. Can people hear me?
Yeah, we can hear you.
Excellent. Okay. Thank you very much for having me, and hello to all the familiar names and faces from my friends and colleagues from my previous time at UBC. And it's an honor to be able to come here today and share with you some research that myself and my students have been doing over the last summer. And I would just like to say that in many cases, this project, we are standing on the shoulders of the giants in this area, many of whom are faculty and researchers associated with the wildfire research that's been done both at UBC and the BC CDC. So we thank you for the work that we have done. And this is what we feel is our piece in trying to help move the excellent research that you've all done into actually engaged action in communities. So I am joined by Prem and Ravneet, who is going to be staffing the chat, and we'll be asking you for some input. I'm hoping this presentation is relatively short because I really want to hear from you and what we can do in our next steps. So SFU would like to acknowledge the Musqueam, Squamish, Tsleil-Waututh, Katzie, Kwantlen, Quaquot, Coquitlam, Semiahmoo, and Tuasin's people on whom their unceded territories these three campuses reside. But also I would like to say that our outreach was really conducted in the traditional territories of many First Nations peoples whose ancestral footsteps and rights really extend beyond the colonial boundaries that exist today. So we honor these people, and I would really like to personally thank the many who actually welcomed us into their communities during our summer project. So today's presentation, just a quick overview. We're going to talk about a knowledge mobilization intervention that we did. We are in the middle of evaluating it. And in a nutshell, if you only get to see this slide, the reality is we've developed a community-based program to reduce wildfire smoke exposure for at-risk populations. This was a pilot project started here in Vancouver in the summer of 2003, and it is the first step in a series of larger outreach projects that we plan to do next year and going forward. So we are here from the Pacific Institute for Pathogens, Pandemics, and Society, which is a new institute funded in part by the Ministry of Health in BC to prevent, prepare for, and respond to major infectious disease events. And you might wonder why we are here talking about fire smoke, if that is our mandate, but that will become clear as the presentation goes on. So my immediate team is Prem and Ravneet, Ella on the top, Tatiana, who's not pictured here, oh sorry, and Gladys. I think I went too quickly. I don't know what's going on here. But I was also joined this summer, and Jenny, by Dr. Vahid Hosseini, who is a faculty at SFU's School of Engineering. Katia Tynan was a real champion of this project from the city of Vancouver, and the BC Lung Foundation played a major role, Drs. Noah Questel and Men Biagton, in helping to both fund and host this project. We also had some other funders and sponsors. I have to say this is one of the most interesting projects I've ever worked on because we were provided with funding as we were doing this outreach. So we started with funding from BC Lung and SFU, but we quickly received additional funding from many of these other organizations. And I think that in part speaks to the criticalness of this research and the timeliness of the idea of mobilizing evidence into practice around fire smoke, particularly in this province. So it was a bad year. This is not news to any of you on the call. The fire smoke season started early. It started in the East Coast, which of course was interesting, but here in BC, we were heavily impacted by, what is every year the worst year ever. So I'm not telling you anything you don't know. There was also a high profile case of a young boy with asthma who died of what they believe was fire smoke exposure as an asthmatic. So it has not been a good year, and likely it will continue to not be a good year next year and the years going forward. So we consider this research to be an important part of shaping the future of community resilience for British Columbians. So as many of you are aware and probably contribute to some of the excellent research of the impact of fire smoke on people's health. And I'm not here to debate that, and many of you can probably speak to this in much more detail, but the reality is that reducing exposure to wildfire smoke is the best way to protect people's health. We are encouraging people to stay indoors during extreme fire events, but the reality is those indoor air environments need to be safe. And so portable air cleaners that use HEPA filtration can effectively reduce smoke particulates from the indoor air shed. So we are encouraging people, this is public health and resources from the BC CDC, we are encouraging people to adopt new technologies into their home to reduce their exposures. And they have some real advantages. This kind of technology is good for people who are tenants, people who can't make changes, external changes to buildings or to mess with their HVAC system. They're also very useful during crises or emergent events. But there are some challenges to this technology. The units and the filters can be very expensive, and they require filter replacement and maintenance. What we also see is panic buying and supply chain issues. And then in the rural and remote areas that are often disproportionately hit by fire smoke, accessing these technologies can also be difficult. And just to put this into context, Consumer Reports, which is my go-to for when I'm trying to buy something, lists, so 2021 was the last time they did a comprehensive overview of air purifiers. And I own a Honeywell unit, so that's towards the bottom of their top 10. And it was, $290 US in 2021. And over here, you can see it says it costs about $200 a year to operate that. And I will attest that I have to change the dual filters in that unit a lot. So not only was it expensive to purchase for me, but it continues to be something that I need to maintain. And some of the better units do work a lot better, but again, they are a lot more expensive. So this is really out of the reach of many people on limited budgets. What we saw this year as well in the United States on the East Coast was scarcity. So because there was so much smoke in the Eastern Seaboard in densely populated areas, air purifiers ran off the shelves. Many of the companies the stock market, the stocks shot up because people were buying these technologies and they ran out. So this is a concern if we're relying on this to protect people's health. So there are alternatives to commercial models. There are homemade versions. So this is where we come back to COVID-19. So these were not invented for COVID-19, but the technology evolved dramatically during the pandemic. And one of the best known is the Corsi-Rosenthal box. I'm sure most of you are familiar with what that is. That's D and E and even sort of an adaptation of F here. These are fans that you can purchase at a hardware store. A shroud is added, and Prem is going to talk all about a shroud later on. And then these have been shown to be effective at reducing particulates, not gases, but particulates in the air. And there's lots of homemade videos that are out there. I was in a Canadian Tire and there was a man standing right next to me with his phone out and his YouTube video trying to pick out which devices he was going to, or things he was going to pick to make his Corsi-Rosenthal box. So people know about this technology and they're trying to make them themselves. But the big question is, how well do these things actually work? And I believe Dr. Eichelbosch is on the call here today, but my hat goes off to her because she took on the thorny question of, do portable DIY air cleaners rack up against commercial units? And can we use them, particularly in emergent situations? So she did her evidence review at the National Collaborating Center for Environmental Health. It exists there with a number of supporting resources. I strongly encourage you to look at this if you have not yet. It is a very detailed overview of an assessment of both the efficacy and effectiveness of these devices. And she also thankfully included a range of different configurations and fan types. And so overall, the results of her finding are that these are effective, affordable, and accessible solutions during fire smoke events. But there's some caveats. The specifications are very important. These are not HEPA filter devices. They're MERV 13 or better filters that, if run over time, can significantly reduce the types of fine particles that we're concerned about in fire smoke. But not all fans are created equal. You have to have a strong enough fan. You have to have a filter that's at least that specification. And the shroud is a helpful addition. But the other thing to realize is that size is important. So you have to match the unit to the room size that you're going to be trying to clean. So those larger Corsi Rosenthal boxes do a good job of a big room, but they're a bit big for smaller rooms. And for this project, we focused on a much smaller unit because we were targeting urban populations and people who lived in smaller apartments. So again, here is a link to her resources, but there's not just the evidence review, there's other resources, including facts and links that people might want to go to. In her review, Dr. Eichelbosch made it very clear that the clean air delivery rate, which again was the unit of analysis for this, you can see here a 1-by-1 design. So this is what we chose, a 1 fan, 1 filter design, because we were targeting urban populations in small apartments, particularly those lived in by seniors. So the 1-by-1 designs here in this study by Holder, you can see compared to a commercial unit, about 27 cents per clean air delivery rate versus about $1. Going down one, you can also see that the commercial unit, which costs about $1 per counter, was again significantly better with the Corsi Rosenthal, but also much cheaper still with the 1-by-1 design. So overall, these units are effective, and which is what we selected to go ahead with. Oops. So this is just a quick picture of our 1-by-1 design. This was a gentleman in Hope who built it himself. And again, we selected these because we were looking at risk urban populations in apartment or smaller type dwellings. And this turned out to be a really smart move. We didn't realize it until we got going, but there were other reasons why the 1-by-1 design was pretty important. So our goal this summer was to take that important work from the NCCEH and mobilize it. How do we move it from the web into practice? And our idea was to target those people most at risk from wildfire smoke. And again, thank you to the many of you who have done the research to help us identify those folks. So we looked at seniors and people with existing lung diseases, both children and adults, mostly asthma and COPD, as the people that we would go to and talk to about the DIY air cleaners and see if they could build them. So we developed them, refined a workshop format. We made some materials that Prem will go over, and then we created a train the trainer guide. So my ultimate goal here is to figure out how to essentially weaponize this technology and get it to communities. So when there are crises or issues, people can teach their own people how to make these filters and hopefully reduce people's risk. And then we decided to evaluate this program. So we're in the middle of that process. So I'm going to hand it over to Prem now. He's going to talk a bit about the project overview and then some of the specifics of the workshops themselves. Are you there, Prem?
Yeah, thanks, Anne-Marie. So here we've got a time. Yeah, hi everybody. First of all, my name is Prem. So here we've got a timeline of our project so far. As you can see right now, we're in the workshop implementation and research phase, but this has been a long process where we started first with connecting with partners. So Anne-Marie can move to the next slide. Yeah, so the first thing we really wanted to do was get together with all of our community partners. So we held a demo day. So this was held at the BC Lung Foundation in May. We invited the regional health authorities, engineers from SFU, staff from the City of Vancouver, as well as BC Housing. We took feedback on the instruction materials that we made at the time. And basically, we took this time to brainstorm ideas for workshop formats, the target populations that our community members wanted to focus on, locations for the workshops, funding, and generating interest. So this was the very first iteration of our instructions. Not a lot of pictures. We really didn't know what steps people would have the hardest time with. We didn't know exactly who would show up to the workshop. So this was the very first one we made, and now Anne-Marie's gonna show us. This is our most recent iteration. As you can see, there's a lot more pictures, a lot more illustrations. This is 2 pages, so 1 page double-sided, but at one point we were up to 5 or 6 pages, and that was too much. So we've landed with this. The hardest part, honestly, of these instructions is having to describe what the shroud is. So the shroud is the border that goes around the fan. So if Anne-Marie can go to the next slide, I think it'll show. Yeah, okay, so we've got a picture here. I have like nightmares about the shroud, having to describe the shroud to people. It's a border that goes around the fan. And what happens with these fans is the air gets recaptured into the corners of these circular fans that are in a box. So what we do is we cover the outside and with these dimensions. So it's about 2.5 inches on the outside and 5.3 inches on the corners. And so when we do this, it increases the CADR, the clean air delivery rate, by about 40%. So this is a really important step for these 1x1 fans. They don't have as high of a clean air delivery rate as the 4x1 fans where we have 4 filters. So this isn't a step that we can skip. And there's a lot of research that's been done on why the shroud is important. So yeah, so one thing we decided over the summer is that we really wanted to make instructional videos to go along. So we rented a studio at SFU, and we had a really good communications person. So we're gonna watch the shortened version of our video if it'll play. No sound. This is a little jingle. You can just imagine.
Okay.
Oh. All right, okay. So basically it's a 1-minute video that goes through the entirety of our steps. There's a longer 10-minute video along with it. They're both on YouTube. Ravni can link to it in the chat, but it's a really good tool because really what the goal of our instructions is that we'd be able to send them out en masse to communities where we wouldn't be there. So the goal is for people to be able to put all the materials together on their own without our support. So that's really the goal when we were making those instructions. So now this is an additional handout that we give to people at workshops as well. So we've got the safety considerations that are from Dr. Ekelbosch's paper, but we've also answered a couple other questions that people have. So one question that people ask is, where do they put the air cleaner? So we recommend putting the air cleaner where you spend the most amount of time. And these are small enough where you can move them from one place to another. So usually people will just keep them in their bedroom. People were wondering if they should put it in the window, which you're not supposed to do, but that's like a common question that people have. So we have a little picture that just shows it, in a room away from walls. But the very main question that we get is about the filter and when to replace the filter. So unfortunately, there's no one answer about when to replace it. We've got a couple tips for people about filter discoloration and if there's dirt and debris that's caught in the filter, like visibly. So those are the 2 clues we can give people. It's supposed to be between 3 to 6 months. But this is a really important part for people to actually change the filter because it's really expensive. It can get up to $25 to $30. And the target populations that we're going for were sometimes living in SROs or low income, and they wouldn't be able to afford to change it very often. So we needed to include that. This is also an infographic that we created over the summer as well that just gave the pertinent information about our fans. It just shows the filter, the box fan, and the tape. And an interesting part about this was when we started, this was really about Firesmoke, and we didn't really want to talk about COVID. So when we created this infographic, we decided to have like these like pathogen, like respiratory pathogen type looking things to sort of pivot to what we're doing now. And now we're talking about COVID and respiratory pathogens when we're at our workshops. But really when we started COVID, and like if you think back to May, COVID was kind of gone. People weren't really getting COVID as often, but now it's like I'm sure everybody knows somebody that has COVID or had COVID recently. So it's becoming more of a topic that's getting okay to talk about again in a way. So here's some pictures of our target populations over the summer. On the left side, we have, we're back. On the left side, we had a few Chinese speaking workshops specifically. So we had 3 or 4 Mandarin and Cantonese workshops. The picture from the middle is we did an asthma camp at the BC Lung Foundation. And so these children have asthma and other lung conditions. And on the right side, this is an image from Better Breathers program that the BC Lung Foundation has. And the people that go to the support group are people with COPD, pulmonary fibrosis, and other lung conditions. We also did some workshops for indigenous groups. So this was the Squaw Nation in Chilliwack, and this nation was particularly affected by flooding. So while our units don't prevent mold growth, they can prevent the spread or slow the spread of mold growth in people's homes. So it captures mold spores. So unfortunately, this area was really impacted by the flooding that occurred in 2021, and that's impacted their housing over the years, unfortunately. And I'm going to pass it back to Anne-Marie.
Okay, thank you very much, Prem. So to date, as of now, we have done 21 workshops. We hadn't expected to do this many. And as Prem had noted, we are still booking them. So surprisingly, or not surprisingly, people recognize that these were useful for respiratory pathogens. And now we're getting requests to come again to seniors, mostly seniors related centers, to help build units to deal with things beyond fire smoke. So I think it's kind of a good sign in general that the public is realizing that ventilation is a solution to health and disease. So the locations that we did the units in stretched from the West End all the way out to Hope, the 2 Indigenous sessions, the 4 live translation sessions in Chinese, and then the 3 with the lung patient groups. And our most usual space was a seniors and community center. This is Iris's unit that she made. It was very cute. We used a Lasco 80-watt fan and a MERV 13 filter and duct tape. So costed out for our units, they were about $70 per unit. We tried using bulk buying and procurement to help reduce our costs. We managed to get the filters down, but the fan stubbornly stayed at about $50 a fan. What we realized was that duct tape use is significant. It takes about a half a roll of duct tape to make one of these units, and that not all duct tape is the same. So some of it is much harder to get off a roll than the other. I strongly recommend people use 3M duct tape if they're going to do this, because it is the easiest to peel off. And while the decorating just looks sort of cute, it turned out to be a really important step as the project wore on. So we were able to manage about 20 to 25 people per session, and that's including a team of 3 people, and we often had a few volunteers. 2 people per table was about normal for those rectangular tables. That configuration worked best. Overall, we were able to get the majority of people who were above 55. So almost 70% of our population, or just over, was above 55. There were some younger people, but we were pleased to see that we were hitting our target demographic. And of those folks that attended, just about 60% were people with medical conditions, health conditions, the majority of which were lung diseases or complex conditions that included lung diseases. But we did see 40% of people who were relatively healthy, but just interested in reducing their risk from fire smoke. One of the big things, though, that struck us right away, and was we were very grateful that we'd chosen the 1-by-1 design, was that a lot of the people walked or took transit, and it was going to be hard to get their units home. So Katia from the city of Vancouver came up with this brilliant idea of using the box itself as a carrier. So we all got really good at using duct tape for a handle, and just some innovation on ways that people could take them home on the bus or walk home. And these units are quite light because the fan is not that heavy. So there was only a few cases where we actually had to have drives to drive the unit back to the people's homes, and those tended to be very frail seniors. We did ask people if they could read the instructions, and most people found the instructions easy to read, but there were some people that found building the units was kind of hard. So you see the very easy, and easy was kind of our medium, but it did take some effort for some seniors, and there were people who were too frail. So people with arthritis had a hard time with the box cutters. The U-line tape that we had in the beginning was not useful. It was too hard to pull. So these are really not a good solution if you have very frail or bed-bound folks. The people who came in wheelchairs needed helpers as well, and those with oxygen tanks, it was just a bit hard. So if you really are wanting to target the very ill, obviously a different solution is going to be needed. We had some real challenges with stuff. we had a lot of stuff. We bought fans early, recognizing that there could be supply chain disruptions, and then we had to store it. And there's a lot of things. So this is Jenny and Tatiana, just trying to manage all the different units. We had to move them around the city. So thank you to Vahid for giving us space in his lab in Surrey. And we had to rent vans. And if any of you have ever rented a van, you know that the woes that go along with rental vans. So just the sheer logistics of getting stuff around should not be underappreciated. And some important considerations is that this is something that you would like to do. These sessions were very popular. Often more people came than we had expected. We learned to take more units and more stuff with us. It was best if we partnered with the different community groups because they knew who their most vulnerable people were, and they could help us limit enrollment. The spaces, though, need to be accessible. If we're going to target people who are older or who may have lung health conditions, you need to have a space where people can have a wheelchair, a walker, or an oxygen tank. It needs to be easy for us to load and unload the materials. You need that 2 hours. Setup was considerable. Every table, as you can see here, had a fan, a filter, a consent form, because we went through SFU Research Ethics Board to get consent to do this project. And then volunteers are very helpful. We had to provide childcare in certain sessions, and we got really good at building castles with the boxes that we had. So we did both qualitative and quantitative assessment using exit interviews. For the qualitative findings, the majority of open comments were really positive. People were so thankful. They enjoyed meeting each other. They enjoyed spending the time doing this session. What we did find, though, was that nobody wanted a lecture. And these are low-tech environments. So thinking you're going to show up with your laptop and give people an earnest presentation about fire smoke hazards, that's not going to happen. So as soon as people got there, they wanted to get into the box. They wanted to get cutting and building. And then the other interesting thing we found was that we did these repeated sessions in the same place over time, and people talked it up and people came back. So they would come to another session and ask for another filter. And the city of Vancouver was able to fund 2 filters per person, so we could give people another filter to take home. Again, they retail for quite a bit. So this was a considerable savings for people on a fixed budget. But the word of mouth promotion was great. So these ladies were here because another friend had brought them who'd come to our first session. So there's a sort of a viral spread of the effectiveness of this intervention and just the joy that people had in making them. I'd just like to give out a shout out to Rick Medley, who was a real champion of this project. He suffers from pulmonary fibrosis, and he is on a wait list for a lung transplant, which he likely may not get. So he participated in one of our first sessions at BC Lung. And he was so captivated by this. The unit worked really well for him. So he waited with his daughter until the Amazon Prime Day in the summer, where he spent his own money buying enough to build 6 units, which he donated back to BC Lung for them to turn around and give to vulnerable people. So thank you so much to Rick for your interest and continued support, because he's now become a real champion of this project. So back to the qualitative findings, this decorating time that we had at the end was actually really important, because that was the time that people had calmed down, they'd made their unit, they were having fun with stickers and duct tape, and then they started to talk. And what we heard was that climate anxiety piece. People are aware of fire smoke, they know it's a problem, and they don't know what to do. So this was also a place where we got a lot of questions about extreme heat. So my recommendations going forward is that we need to co-locate information in communities both about extreme smoke and extreme heat and how people can protect themselves. There were a lot of people who have to open their windows because they don't have air conditioning. And so they wanted to know how to use these units while they were having their windows open, because they'd heard they were supposed to go inside and shut their windows and doors, but it was getting too hot inside. So I think as public health professionals, we need to find a way to address both of these issues at the same time when we're out in community. So the project has so far, I would say, overall been quite successful. Again, we're still getting requests for workshops, and we have expanded back into our respiratory pathogen mandate that we started with. And yeah, not to underappreciate aesthetics, people were really making these units because they wanted to have them at their house. And so they wanted to make them look nice. And for a while, we had different colored tape. So we had yellow and black, as you can see here, but people didn't like that. They liked the white tape. So we actually had a bit of a mutiny at one point where we'd had gray tape and people were like, no, no, we need white tape. So we had to send someone out to go get white tape so that people could use them because they looked a bit more aesthetic. So the common questions we got were, are they safe to operate? And luckily, there has been some analysis that's been done by this. The US EPA commissioned a report on the fire safety of the units. There's a new report that's come out as well. And you can see here that there are varying stages that this is from this report where they looked at the fire safety hazard, because of course this fan was never designed. The fan was never designed to be something that pulled through a filter. But there's been robust analysis and the units are considered safe as long as they're used as directed. So that means that they're plugged into a wall in particular. So we have developed a Train the Trainer guide. This is a comprehensive 20-page manual to help communities if they want to do this themselves. It includes things like shopping lists, what you would need, and a lot of the lessons that we've learned today. And our next steps. So we have 100 people so far who have agreed to a 6-month follow-up. We have a survey where we're going to be asking them questions. If this is something of interest to you, we are still in the survey development stage, so you could let us know. It's going to be a phone survey because we did experience the digital divide a lot. A lot of people are seniors in this group. So we've just decided that the phone is the best way. 30% of people are Chinese language folks too as well. So we will be dealing with that through translation. But we want to know, did people use them? Did they change the filter? Did they take the filter off and just use it as a fan? Was it noisy? And then turning to next year, the City of Vancouver has more neighborhood houses it wants us to do. So it is committed funding for next year. We're soliciting input from students who'd like to be part of this intervention type work. And we're expanding our project to interior, island, and northern BC. So we have secured some internal SFU funding to begin that, but we're also looking for other partners outside of the city so we can take this to wildfire adjacent communities, not necessarily ones that are likely to be evacuated, but places where we know people are going to be exposed to smoke for sustained parts of the summer. We're also collaborating with the Métis Nation of BC to help them help communities like using the Train the Trainer guide. And we're collaborating with SFU School of Sustainable Energy Engineering. So right now, this is Scott, and he is one of the engineering students that's taking part in looking at the units and seeing if they can come up with some innovation to make them easier and cheaper for us to use. So in summary, there is a lot of interest in DIY units. There's a lot of people who have very limited budgets right now, and climate anxiety is a very real thing in our communities, especially in older people. These are affordable solutions, but they're not for everybody. Frail people, homebound ill people are not going to be able to make these. This project requires partnerships and planning, storage, staff who have good people skills, and people with driver's licenses. And it would really benefit from adding this education about extreme heat. So a big thank you to all the people who made this possible. It really was a team effort. So I'm just going to shout them out here at the end, to Jenny and Tatiana and Dr. Hosseini, Katia Tainan, our big champion from the City of Vancouver, Ella Ravneet, my students, Gladys and Vicky from PIPS, and Rakib Tasfehi and Kaylee Byers, who helped us navigate through ethics and other things, to Dr. Eichelbosch for all your hard work, Noah Questel, Men Biagton, Deborah Wong, and Chris Lam for BC Lung for housing this project for us, and Eli Ross from the Fraser Valley Regional District. We couldn't have done this without you and your funding. And to everybody else who participated, all the hardworking volunteers at the neighborhood houses, and all the happy people who have gone and spread the news of this to their friends and family. So I'm going to end there. And if you are interested in joining us, if you have students that might be interested in taking part, if you know people who work with expecting parents. So over time, we're learning about the literature around prenatal exposure to fire smoke and early life exposure to fire smoke. So I'd be really interested in talking to people who work with expecting parents and seeing what we can do around protecting people during that period of life. And I'm going to stop there. So I'll turn it back